The United Nations Children's Fund, UNICEF, says that 10.4 million children are projected to suffer from acute malnutrition this year in the Democratic Republic of Congo, the northeast of Nigeria, the Central Sahel and Southern Sudan, as well as Yemen. It says that these countries are already reeling from the consequences of conflict, disasters and climate change. The UN aid agency says that the deadly COVID-19 pandemic has now turned a nutrition crisis into an imminent catastrophe in these countries. To tell us a little bit more, I'm now joined via Zoom from South Sudan, the capital Juba, by Acting Representative of UNICEF, Mads Oyen. Thanks so much indeed for joining us and welcome to the program. It's a sad beginning to the year for many children in the areas that we've just described.
Well, thank you for having me tonight, Peter, and Happy New Year. Indeed, it is a sad beginning of the year. 2020 has been a very difficult year for children in South Sudan. They have been really bearing the brunt of the COVID-19 crisis, and that follows a very difficult year for many children in South Sudan in 2019, with what we thought was once in a century flooding then, which was followed by once in a century flooding this year as well. So it's been very difficult. So indeed, yes.
What kind of numbers are we looking at in South Sudan in particular?
Well, in South Sudan alone, UNICEF is very concerned about the deterioration in food security. We are looking at 1.4 million children at risk of severe acute malnutrition by April 2021. And we're looking at probably increasing the number of children treated from 292,000 to 313,000 children. So it's a significant increase in the number of children that will need to be treated. Of course, where we also need to rapidly invest is in prevention. For us, we have a cure rate for treating severely acute malnourished children once they come to us or once their mothers bring them into health centers. We have a cure rate of 94% on average. It is quite miraculous to see how these children recover, but it's nevertheless a recovery. It's not desirable. We would much rather that they stayed healthy. And for that, we need to also not only increase our preparedness to receive more children this year, but we also need to quickly increase our investments in prevention. And that's preventing malaria. It's preventing waterborne diseases as well. It's having immunization against measles, and other vaccine preventable diseases. And it's also ensuring that we have access as well.
Talking about access, I mean, where are these families? Are they quite widespread? And I would imagine, particularly after flooding, some areas are quite difficult to reach.
Well, yes. So our access, the most affected areas are in Jonglei, as well as in Barghazal. And in Jonglei, it's really Akobo and Pibor areas that are most affected. They have been severely affected by flooding. Like I said, 2 years in a row. And this really has an incredibly socially destabilizing effect as well, which means that it's difficult to continue operating health centers. And the sheer physical barriers are extremely difficult to overcome. Many areas are only reachable by helicopter, which is extremely expensive. And the window of the year when trucking is open has been so short in 2020. I think in Pibor, we were able to do things only for 2 months between the end of the flooding and the onset of the new flooding. In addition to that, the unsettled political situation in the country, where officials haven't been appointed, also has an impact. So it makes resolving local issues more difficult and sustaining services more difficult. So we both have a resource constraint. If we don't get resources early enough, then we can't pre-position them during the dry season. And then that adds on to costs as well, having to use air assets to pre-position those supplies. That adds to the cost. So what we need is to have the resources early, and we also need to now invest quickly more in prevention as well. What happens is that in April, when the rains come, within 3 weeks, you see mothers coming in with the children, and it's very closely linked to malaria and other as well as waterborne diseases. But malaria is really one of the triggers that makes it a very seasonal issue. And it's just devastating to see all the mothers coming in at the same time with these children who are so desperately sick. Of course, it's also very heartwarming to see when we are able to respond with quality care for those children.
All right, and there's still very many children that remain vulnerable, particularly those under 5. What could be the consequences of acute malnutrition for a prolonged period of time, which makes this such an urgent issue to deal with?
Well, going through an episode of severe acute malnutrition has developmental and long-term health implications for those children. Of course, if it's not treated, then it's also life-threatening. So it can result in stunting. That's one very physical, measurable impact. But it also leads to learning difficulties, and it leads to other health difficulties later on, increased respiratory diseases later on in life, for example. So it has all kinds of knock-on effects on the well-being of those children.